Good morning. This is Dr. Dipali Kashyap. I'm a gynecologist with the Gallery of Women's Health, and welcome to our tea time. Today I'm going to talk about hot flashes. Now, I've talked about menopausal symptoms in the past, but I feel hot flash deserves special attention. The reason being about 25 million women in the United States and about 1.1 billion women in world overall are going to experience hot flashes by year 2025. So they do deserve special attention. Now, what is a hot flash? So, hot flash is a feeling of heat sensation, especially in the upper body, like the face, neck, chest. It lasts for about 5 to 10 minutes, but it can also be associated with feeling of chills, anxiety, breathing really fast, and a lot of sweating. Now, when it happens at night time, that's when we call it night sweats. Now, depending on the severity, it can be very mild, where there is only just sensation of heat. It can be moderate, where there is a lot of sweating, but you're still able to do what you're doing. Then there is severe, where it really stops you from even finishing what you wanted to do. Now, the hot flashes are annoying, right? They do affect the quality of the life, but also at the same time, it has been seen that women who experience a lot of hot flashes, especially severe, they're also at increased risk of cardiovascular disease like atherosclerosis, high blood pressure, increased heart problems, and also osteoporosis, which is weakening of the bones and also leading. So it's important to address hot flashes. Now, before we go into detail, I do want to talk a little bit about how we actually manage or maintain our body temperature. So there's a tiny part in our brain which is called hypothalamus, and it maintains a body temperature of 98.4, 98.6 degree Fahrenheit. Now, this random temperature, because this is a temperature at which all our body organs perform perfectly. So that's why body, being a healer in itself, tries to bring us back to the temperature, this temperature, even if the body core temperature goes up or down. So take the example of your home with the windows and insulation. So when it's very cold outside, what do? We want to conserve the heat. So we close all the doors, we close all the windows, we turn on the fireplace or we turn on the heat, electric heat, because we want to conserve the heat and energy. At the same time, when it's the opposite, when there is cold, when there is hot, we want to get rid of the heat. So we open the doors, we open the windows, we turn on the fan, we turn on the air conditioner, and we want to get rid of the heat. So our body is doing the same thing. When it senses that the body temperature has gone up, then actually, let me take a step back. So our largest organ of our body, which is called the skin, there is fat underneath which acts as insulation, and there are some small blood vessels which are called capillaries, which are almost like windows. They are present throughout underneath our skin. So when the body senses, okay, the body temperature has gone up, it senses, the brain detects, it sends the signals by something called peripheral nervous system. And what they do is they open up these windows, the capillaries, so there is increased blood supply, and that's how we get rid of the heat. There's also sweating, which is basically losing heat by way of water, and which further evaporates and then cools down our skin. At the same time, lungs, we start breathing a little bit faster. That's the way to get rid of the excess heat. On the other hand, when it is too cold and the body wants to increase the temperature, what it does is these windows, the capillaries constrict. So there is decreased blood supply to the hands and feet. That's why you feel the hands and feet a little bit cold. And this blood is actually then moved more to our vital organs, to the heart, lungs, and stomach, everything else which we want to keep warm. At the same time, the skeletal muscles also start to contract involuntarily. That's why you feel those shivers, because by doing that, it's generating a little bit heat, again to conserve energy. At the same time, certain hormones are produced, which also increases our metabolism and generates some heat in our body. So the body is amazing. It does all these things. Now, the question I have is, if this is happening, so the central and the peripheral nervous system are working together in synchrony, or I'm not saying it correctly, but yes, so they work together basically to attain perfect body temperature for all our vital organs to function. Now, if this is happening, then men should be experiencing hot flashes too, right? But we don't hear about that. So it has to do something with our hormones, especially estrogen. Because we have noticed that we start experiencing hot flashes, night sweats more at the time of perimenopause and menopause when these hormones are declining. So it has to do something with that. We don't 100% understand what is the exact mechanism, but there are few. So I'll go over it. So one is the thermoregulatory center in our brain. It works at a window, like certain range of temperature, but and which is maintained by estrogen also. So lack of estrogen really narrows down this window. So what that means is that even a slight change in the outside temperature causes huge changes in our body. So there's more sensitivity of the brain to these minute changes in the temperature, and it starts the whole process, tries to conserve, get rid of that heat. Second thing is there are these tiny glands which are called adrenal glands that sit on top of our kidneys. They make cortisol, they make even some of the sex hormones. Again, when our body detects that there is not enough estrogen, is trying to do everything, telling the brain, okay, let's do something and make some more hormones, then even these adrenal glands get overstimulated. There is increased release of not only some of testosterone, androgens, cortisol, but there's also release of something called epinephrine, norepinephrine, which works on our peripheral nervous system, which plays a role in thermoregulation. So combined, these things are causing what we're experiencing, hot flashes. There's another chemical called serotonin. It's a neurotransmitter and it plays a huge role in our sleep, our arousal, our day to day activities, our mood. And that hormone is also increased a little bit, and that also increases our body temperature. And there are a few other things which I'm not discussing right now also play a role basically in causing these hot flashes. Now, next question. So, what can we do about it? So, I always start with something very simple, which is free of cost, easy to do, and you can do it by yourself. You don't need to go anywhere. First of all, like we said, because the body is brain is very sensitive to this temperature. So, even managing that, like always wear layering of clothes, right? So, whenever you feel there is a little bit of raise in temperature, just take off a layer. That way, you're still maintaining the core temperature. Drinking cold liquids, because when you do that, again, you're bringing your core temperature down. Staying in cool places, or carrying a small fan to, again, reducing the core temperature. Then, as we said, there's a fine balance between our central peripheral nervous system and overstimulation these days by a lot of external factors create problem. So even some mindfulness, yoga, meditation, they seem so simple, but they really help in helping with hot flashes. Then there are certain over-the-counter things. You hear about a lot of things like maca, donquoi, black cohosh, evening primrose. Scientifically, they have not shown to be that beneficial, but still we could try and see along with other things and see if they make a difference. One of the over-the-counter products which I use quite a lot in my patients is rhubarb. So it comes under various name. I use a preparation called Estrovera, which is made by Metagenics. But there are a few others which use Siberian rhubarb, and there are other kinds of rhubarb which have proven to be helpful in reducing hot flashes. When it comes to medications, just like we talked about serotonin. So the medication which blocks too much serotonin, it's called paroxetine. It's the only FDA approved non-hormonal treatment for hot flashes. It also helps in relieving depression. So when I see somebody who has low mood, has a lot of hot flashes, and maybe doesn't want to use hormones, or maybe not the right person for hormones, so this can be used, and it helps in better quality of sleep, reduction of hot flashes, elevation of mood. So it's useful. Then few other medications like gabapentin. There's another medication which is called clonidine, which actually work on our peripheral nervous system, because we talked about how peripheral nervous system also plays a role. Now, coming to the ones which is the therapy which is FDA approved for hot flashes, it is the hormonal therapy, because hot flashes are caused by lack of hormones. So using estrogen can help in various forms, like whether it is a patch or creams, can help in relieving hot flashes. Again, if you have uterus, you have to use estrogen with progesterone, or if you don't have a uterus, you could use estrogen alone. which help with relieving hot flashes, a lot of other symptoms, osteoporosis, and many other things. So there is hope. So there are a lot of things that can be used just at home, or hormones or some other medications. That's it about hot flashes. Well, I hope you find it useful. If you have any questions, any comments, please do let us know. Thank you.